lovely baby now is between 19 to 22 inches and weighs about 2.5 to 3.5 kilos. It's a fully formed baby with all its lung surfactants ready. Your baby needs to come out anytime whenever the baby is ready. As regards your body, you need to keep a watch a lot on your fitness. As I am standing here amidst this gym equipment, I also want you to remember that pregnancy and labor is also like a stress exercise. The way you work out on this gym, you need to work out in pregnancy using the different instruments your body has naturally designed from you. Now your abdomen has become really full, the leg kicking is quite a lot as there's less space, you have leg cramps at night, you have more of leg swelling, increased backache, heaviness, increased urinary and bladder complaints, and easier breathing sometimes after the baby drops in the pelvis. Emotionally, you may be finally relieved that the 9th month has come, and you have mixed dreams about labor and a fantasy about what's going to happen to your baby. I'm sure you'd like to know a lot of health tips at this time. Now your backaches have been increasing and there is always a constant pressure on the lower abdomen. How do you know the symptoms of true labor and backache caused by true labor contractions or general backache? Always remember, true labor contractions will come from back to front and they are associated with a hardening of the uterus, a tightening of the uterus, and also there will be a dilatation of the cervix. Remember, true labor contractions will not go down. They will increase in intensity if they were coming, and increase in frequency, which means if they were coming every 20 minutes, after some time they'll start coming every 10 minutes. If they were lasting for around 30 seconds, they'll last for say a minute or so. Your body needs to know all these things. When you get your labor contractions, just be calm and cool. Take deep breaths in through the nose and out through the mouth in this way. And relax your body completely and start preparing for the next step. It's a good idea to start perineal massage at this time. Take a little ghee or til oil, sesame oil in your hands and massage the lower area between the vagina and the rectum. This very small tiny segment, which is actually only this much in your body, a few inches long and wide, needs to be massaged with the thumb back and forth and top to down. This is the perineum in the lower down, which gets the thrust of the baby's head. Because of the thrust on the baby's head, this area stretches a lot, and if the perineum is supple, this will really help. This is in fact a traditional massage done by many of the dais in rural India before they are planning for the delivery. So a lot of ghee is put in that area and this area is massaged. You can lie down, fold your legs, put your hand from the side. If you're not sure about doing it since your tummy is quite big, you can ask your mother to help you. Maybe she can wear a glove and take a little ghee in her hands and apply to that area. With this type of massage, the perineum will open up and your body is getting ready, preparing for delivery. The breast also need good care. As mentioned in the 8th month video, you'll just check that the nipples are not inverted and you'll give a little ghee or clarified butter massage to the breast and prepare your body for the feeding. Also in the 9th month, there's a lot of uneasiness. You feel breathless often. So it's a good idea to do all the pranayams which we teach in the pregnancy class. You'll do Jiva Bandha, you'll do Brahma Mudra, that's looking in all 4 directions. You'll do Siha Mudra, taking your tongue out. And taking deep breaths. All these are tackled in the pregnancy pranayam video. So you'll practice all these pranayams because labor is literally like a race and your 9th month is the final preparation for like the race just before the exam. So your mindset has to be really good for all these things. You'll realize that you're feeling very, very hungry in the 9th month. Check that your diet has at least 750 ml of milk or milk equivalents if you don't like to drink milk. So you can drink 2 glasses of milk in a day and maybe have that much quantity of paneer or cheese as milk equivalents. You also need to eat a good diet of proteins because protein intake is very good. Check that you're having a lot of sprouts, dals, legumes, paneer, cashew. All these things will increase the protein in your diet. Also have a good source of hemoglobin, palak or spinach, beet, raisins, jaggery. All this should be taken good because your hemoglobin has to be high. There is sometimes some blood loss during delivery, and in the 9th month you have to pep up your hemoglobin. So with all these precautions regarding your diet, your backache, headache, even stress relieving factors, you'll really prepare well for your baby. It's a good idea, maybe, not to continuously keep working till last day. Give yourself the last week off just to get into the nesting phase and enjoy the process of the labor contraction starting. We will be monitoring you frequently at the stage where we'll be doing your NSTs and just checking the well-being of you and your baby. Just in case you cross the due date, we are watching out for any complications like meconium, and we keep a watch on your NSTs if all is well. My all best wishes and blessings for you and your newborn baby who would come in a few weeks from now. All expectant parents in the 9th month, these are health tips for you, and best of luck for your labor and childbirth.